basically, yeah, I've got it recording.
Okay.
So you just went from talking about their emotional button, and you're just switching over, just explaining a little bit about chiropractor. You're just starting over.
So then, yeah, so I say, so you pull it away from them, you've connected with the emotional button, and then you say, or then I say, let's see, so we go here, give it back to them the way that they've said it to me, and reconnect with the emotional button, and then it's just, you pull it away a little bit, so you say,
I don't know
if I can help you or not, and that's what I'm going to check for now, to see if I can accept you as a patient or not. But first of all, I want to explain a few things about how the practice works. Okay, so when you go to normally when you go to a medical doctor or any therapist for that matter, you have some sort of symptom that brings you to the place. So it could be either a headache, or it could be menstrual problems, or it could be sciatica, or low back pain, or neck pain, or any of the many different things. And generally, I'll just use some of the symptoms that they've given me.
And you draw this box on there?
I draw the box, and then I just and then I draw a little line when I talk about each symptom, and then I say, and generally what it is with each treatment or with each pill or medicine, there's a treatment for each specific symptom. So it's like it's focused on each symptom that's there. We don't work on that level, so what we do, so I just cross it out. So what we do is, and then draw another little box above, is we work on the cause. And so what we take care of is we make sure, like you heard in the class, we make sure that your nervous system is working properly. And when your nervous system is working properly and your body's in balance, then it can heal itself. Okay, and when that happens, it's like if, and then I just use the example about a car and the lights that come on in the car. So it's like if you've ever been driving your car and then the lights flash on that you need to change the oil, well, that's like a symptom, right? The car is just giving you an idea that something needs to happen. You need to take care of something. Same thing in your body. These are just, the symptoms are just your body talking to you saying that there's a problem. So what we do is we go up here, we take care of the cause, we put your body back into balance, and when that happens, generally, what do you think happens to these symptoms when your body's in balance? And they go away.
Yeah, they go away.
So we don't treat each symptom. What we do is we bring your body into a state of balance, and that's what I'm going to check for right now.
Okay. Anything about subluxation or what? At that point, they've
already
it.
had it pretty much. Sometimes I'll grab the spine. I'm kind of inconsistent with that. Sometimes, yeah, I'll just go over again. And the cause, in this case, I mean, there can be many different causes. I'll say that too. But the one we focus on is the spine, and we talked about in the class something called subluxation. So yeah, sometimes we'll go into that.
Which can create any of these symptoms.
Which can create any of these symptoms. And it's our job now. So what our job now is to do is to check to see if you have subluxations, working on this level up here, and to see if we can get you back into balance so that you can get your life back and you don't have to worry about this, this, and this, and you hit on their emotional button again.
Yeah.
Yeah. And how does that sound to you? They're like, yeah, great.
Awesome. So, and then you go into just...
I sit them on the table, and I just do palpation, seated palpation, all the way, motion palpation.
Yeah.
And then if they have x-rays or something there, a lot of them will, I'll look at that as well.
Yeah.
And then but I won't adjust them right then. Then I'll go right into my report right there. And it's a very, very quick report. It's
okay.
Like, then I'll just go into it and say, okay, so yep. You do have subluxation, so I'll either show them on their x-ray or say I'll find it and grind it on their spine so they can feel it, and then I'll say, yeah, you have a lot of interference going on here in this area of your spine, and blah blah blah, wherever it is, and this is what concerns me the most. It's like right up here. This is the most important area of your spine. There's all this pressure going on right here, and does that make sense? If there's pressure on that area of your spine, that it could be causing some of these problems in your life. It's like, yes, well, we need to take care of that. And like we talked about before, it takes time and repetition, and that's what we're going to look at right now. So in your case, it's going to be twice a week for 6 weeks, and then if we see that you're getting into balance there, we'll go to once a week for the next 6 weeks.
Okay.
And at that point, this is your intensive phase. It's like the first 12 weeks. Okay. After that, I'm going to check you, and we're going to do an evaluation and see where you're at. But generally, that's where we start. We're either going to do one of two things. Either continue it once a week, or we're going to look and see if we can space out your visits a little bit. And that's where you get into like a wellness phase.
Okay.
And but let's take it first things first. Let's start with this.
And that's it?
That's it.